Hello, this is Dr. Kikeri again. I wanted to show you what anesthesia means and what the anesthesia machine looks like so that you have a basic idea, because most of the patients, when they walk in, they get overwhelmed with multiple monitors going off, with the beeping noise, with the blood pressure, with the EKG pads and the pulse oximeter and what have you. So I just wanted to ease that tension by introducing what anesthesia machine does. The main component of anesthesia is the breathing component. This is what is the machine, also known as a ventilator, that will breathe for you. And this is where the gases come. And when we bring the patients in, we give them oxygen. And this is the one that goes on their face, where we turn the oxygen on and they can fill their lungs with oxygen. And there are other anesthetic agents here. We have nitrous oxide, which is also known as a laughing gas, and we have even more powerful anesthetics called sevoflurane or desflurane. There are different kinds of very powerful anesthetics that is delivered through this breathing tube. Now there is a different component to this machine. What you see is a monitor where we monitor different aspects of patient's safety parameters, such as blood pressure, EKG, and pulse oximeter. What this does is that this is like a dashboard to the patient's safety. In other words, this will tell us real time, minute to minute, what is going on with the patient's vital signs that keeps them safe, alive. And you will also see another piece of monitor here. This monitor will show us what and how the patient's breathing is going on, whether patient is getting enough oxygen volume, enough tidal volume. This will tell me how many respirations per minute the patient is getting. And another very important thing is that I wanted you to hear this alarm. When the alarm goes off, usually when the patient is not hooked up to the machine, this goes off. This is something that you may hear when you walk in. When you walk in, when you hear that, it is very concerning and very alarming to the patient. Please understand, its real work starts when we connect the patient to this. Therefore, it is a life-saving thing for the patient's safety. When it is not hooked up to the patient, when it is accidentally disconnected, it will give that alarm to alert the anesthesia provider, stating that the patient needs to be taken care of. When all the alarms are going off when you walk in, the patient is not even on the table. Like you see now, there is no patient on the table. There is no patient. It is an empty room. We are doing it in an empty room just to show all the setup that we have. So this is the anesthesia machine and anesthesia setup in a nutshell. There is a lot more details that go into it, but this is just an introductory video to tell you what anesthesia machine looks like.